The subcommittee will come to order, and we will begin with Ms. Thompson. Ms. Thompson, you're recognized for 5 minutes. If you'll punch the button there, pull that close to you, you may begin.
Thank you, Mr. Chairman and members of the committee, Representative Waxman. My name is Sylvia Thompson, and I'm a professional care manager as well as president of NAMI's Westside Los Angeles affiliate. But that is not why I'm here today. Today, I'm my mother's daughter. My mother was severely mentally ill from as far back as I can remember. So growing up in my family was like living in a combat zone. It never felt safe because of her drastic mood changes, paranoia, grandiose ideas, impulsivity, delusions, depression, and inappropriate anger often directed at me. As much as we loved our mother, my family was powerless to help her because she did not believe she was ill. It's called anosognosia. It affects up to 40% of those with schizophrenia and bipolar disorder, and that's a conservative estimate. Because she didn't believe she was ill, she would not stay in treatment, so she could not take care of herself, nor could she take care of me. She had suicidal ideation, delusions, hospitalizations, believed I was possessed, and would disappear for days or weeks. I'm a firm believer in self-determination, but for those who are capable. We must recognize there is a whole group of people, like my mother, who are too ill to self-direct their own care. Just take a look at the news. We can't pretend these people don't exist. These tragic stories, like this morning, they are not the face of mental illness. They're the face of mental illness that is severe mental illness that is left untreated. Our helpline is flooded with calls from family members of individuals who are imprisoned by their delusions and hallucinations. Parents beg for treatment and cannot get it. The current mental health system doesn't help them because their child is too ill to volunteer for treatment. The police can't help until after they become dangerous. It can't be a recovery model or a medical model. We must embrace both because one size does not fit all. Sometimes the recovery model works, but sometimes assisted outpatient treatment or involuntary hospitalization is initially necessary to get somebody on the recovery path. AOT would help the few who have a past history of multiple arrests, violence, or hospitalizations caused by refusing to stay in treatment. Studies show AOT reduces homelessness, incarceration, suicide, arrest, and yes, violence. It saves money, it reduces force, and it saves lives. We need more hospital beds. California has only 5 state hospitals with less than 7,000 beds. Because of that, Californians with severe mental illness are 4 times more likely to be incarcerated than hospitalized. 4 times. That would never be tolerated for cancer or Alzheimer's disease. Even at its best, California would be short over 10,000 hospital beds to help the most severely mentally ill get stabilized. We can't pretend that hospitals are not needed. We have to free family caretakers from HIPAA handcuffs so they can provide care to loved ones. How can someone ensure their loved one has a transportation to an appointment if they don't know when the appointment is? Or ensure they stay on their medications if they don't know what the medicines are? We have to prioritize the most severely ill and stop funding non-evidence-based programs and groups that impede care for the most seriously ill. Congress created SAMHSA to target mental health services to the people most in need. Only 4 in the 288 programs in SAMHSA's National Registry of Evidence-Based Practices focus on severe mental illness. That's 4 out of 288. I urge you to pass H.R. 3717. I'm not a politician. I'm not a legislator. But I am someone who has spent her life in the trenches, personally and now professionally. It's wonderful to want to improve mental health for everyone. But in the process, we absolutely cannot ignore the most severely ill. They are the most vulnerable, and they need your help. My mother struggled my whole life. Before we gained guardianship, she was living in a state of squalor, surrounded by stacks of newspaper, rotten food, human feces, dead rodents. That was how she self-directed her care. No one chooses that life. But you should also know, she spoke 7 languages fluently. She knew every opera libretto, and she was a gifted pianist. She was passionate, she was creative, and she was loving. She was someone's daughter, she was someone's sister, she was someone's wife, and she was the mother to 6 amazing children who were desperate for her to be well again. My mother's inability to acknowledge her illness was not a choice. It was a symptom that trapped her and robbed all of us of her greatness, robbed me of my mother. I'm proud to be my mother's daughter. I inherited her passion, her creativity, her outside-the-box thinking in her memory, and to prevent others from going through what she and our family did. I implore you all to please work together to pass H.R. 3717. Thank you.
Chair thanks the gentlelady.